Hello, I'm Dr. Joe Iser, Chief Health Officer for the Southern Nevada Health District. During the month of September, we commemorate National Suicide Prevention Week and World Suicide Prevention Day to shine a light on an issue that impacts every sector of our society. It is also an opportunity for healthcare professionals to reflect on the role they can play in identifying patients who may be having suicidal thoughts or be planning to harm themselves. Suicide prevention is everyone's responsibility. While mental health care professionals play key roles in screening patients, primary care physicians and their staff are often the only point of contact for a patient within the healthcare system. Every physician should ensure that their staff receive training and are aware of the resources in their community. Primary prevention is key. This means identifying and addressing the factors that are putting people at risk for engaging in suicidal behavior. We've come a long way in our views of suicide, but much of the stigma associated with the topic remains. Healthcare and public health professionals can begin the conversation with all patients, clients, and their families to let them know what information and tools are available to them. Suicide, a suicide attempt, and other attempts at self-harm impact not just the health of the individual, it impacts the family, the community, and society as a whole. Healthcare providers are in a uniquely qualified position to identify patients who may be at risk and to provide information and access to the necessary resources. Physicians must assess their practice to decide how they can best serve the patients they treat and then ensure they have the resources or referral sources to meet the needs of their patients. This is a subject that is important to every healthcare professional in Nevada. There have been too many lives lost and too many families and communities impacted. While there is not one prescribed approach, as healthcare providers and public health practitioners, we must ensure we have the resources in place to meet our patients' needs. More information and additional information on this important topic are available on the state's Office of Suicide Prevention website at www.suicideprevention.nv.gov.